go through the ordering process right away, find out that I can save money on generic, find the lowest price in my area, and then actually order from our online pharmacy. So that's really just scratching the surface of what Orderly can do. We can also help you get connected with doctors and chat with live physicians right away. And there's a few other use cases that we can support. But the key thing to remember for us is that we really want to engage with users. And that's why we chose a natural language processing interface and using AI to power our system. So from this infographic, or whatever you want to call it, you can see that I've circled all of the various different apps that you might interact with on a regular basis that involve chatting. So you've got Facebook Messenger and SMS, Slack, and WhatsApp. And almost all the time, these apps are going to be on a user's home screen or even pinned to that bottom bar. And the reason we did this is that we really wanted to make sure that we could reach out to the users to engage with their healthcare, because it doesn't matter how good your product is if no one uses it. So with Orderly, we can sign up people right away. We can get them, they don't have to change mediums when they're signing up. And then this way they never miss a notification, and they don't have to navigate to that fifth screen on their iPhone or their Android phone to try to see something that we've sent them. Now, the upshot of this is that we are starting to see some data rolling in from our early users that show engagement and activation far higher than what other industry or other competitors in the industry are capable of achieving. Since we're already in these various different apps that they use the most, our sign-up process is seamless. If you sign up on the web, you can complete it on the web and you can start chatting there. If you want to switch over to your phone, we'll send you a text message and then you can chat right away. But what we do is we then capitalize on these initial interactions with our users to continually improve our product and try to connect with them on an ongoing basis, so that they continue to come back and think about us when they have a healthcare question. And that's why we've been able to achieve, a 7 times activation rate and 22 times the engagement rate of some of the competitors that are out there. So I know that you guys are dying to know how to get access to Orderly, and we'd love to have you sign up and try it out right now. Orderly is actually free across the country for all users, and you can just go to orderlyhealth.com and follow the sign-up process there. If you're in Colorado, you can actually sign up to a premium version of Orderly that offers a little bit of bonus functionality and perks, like being able to chat or video conference with a live doctor 7 days a week, 365 days a year, even after hours. We also give you free shipping on medications and a whole lot more. Now, if you're an HR director or a broker and you think that you might have a company or employees that would be interested in using Orderly to manage their healthcare and their benefits, please be sure to reach out. You can email me at kevin@orderlyhealth.com. We're also available at basically almost any word at orderlyhealth.com, info, feedback, founders, and so on. And I know that Jane will be sharing these slides after the webinar. So I'd love to hear from you. I'd love to have you guys sign up, even if nothing else, just to give us feedback on what you think about our product. So with that, I'll hand it back over to you, Jane. Jane, I think if you're there, you're muted.
Thanks so much, Kevin. Yes, sorry, I muted myself to also avoid background noise. This is really cool. I think it's really cool what Orderly is doing, and I think the feedback that we get from this type of technology is really interesting. So of course, everyone should definitely sign up and try it out today. So now let's get right to the topic of today's webinar, which is using AI to drive employee engagement. And I think, all that we've been hearing a lot was, a lot of promise and perhaps threat of AI recently. And we probably have some questions about it. I know I do. And specifically what I'd like to discuss, with everyone in the room today, and also Kevin, are these questions. So one is about what's big data? What exactly does this mean for my health? And two is, why is AI powerful for HR specifically? And three is, is it going to take human out of human resources? And then, of course, the last part is really around technology, right? App or no app. Really what I care about is building a strategy for engaging people. So how do we do that? Sounds good? So let's get right into it. So Kevin, what exactly does big data mean for my health?
Yeah, so I love that we're starting with this question, because I think that, as with any industry, there's a lot of buzzwords around AI and big data. And big data is one of those buzzwords that seems to have staying power. I can't remember the first time I heard it, but it's definitely been over a decade that we've been hearing about the promises of big data. More so now, though, as it relates specifically to health and wellness, I think there is a lot of promise around being able to harness data effectively. And, you know, from my perspective, I would just consider that when people are talking about big data, what they really mean is being able to sort through the noise and parse out the signals from that noise. And there are very few industries where that's more important than that of healthcare. And the reason is, with healthcare, you know, healthcare is not something that is, it's obviously very complicated. And I sort of joke that it's not like math. There isn't just one answer when it comes to diagnosing a patient or trying to figure out the best treatment plan. There are often a lot of different options that you can take. And the promise of big data is to be able to identify those patterns and trends and supplement our medical healthcare professionals with information and tools that they can then use to make the best decisions for their patients. So this pattern recognition can be used to save lives. And the more data inputs that we have, the more we're able to identify historical patterns and the quality of outcomes, the better off that we can become. And I think that harnessing data effectively is crucial for the future of health and wellness of our entire population.
Sounds good. And I agree with that completely. And, you know, sometimes I wonder if AI, right? So if data and AI is so powerful, why is AI needed for HR? You know, like specifically, how many of us in HR, in the human business, we love people. So why are we bringing robots into this picture?
Yeah, sure. Well, I think first it's important to understand what we're talking about when we refer to AI. So from my perspective, again, I think of AI as being the AI that we're talking about today, at least, as being that base level artificial intelligence that powers the software that can respond to inputs or actions from a user, either responding to that user in a predictable way or by performing a task as a result of those triggering inputs. So one of the ways that Merriam-Webster's dictionary defines artificial intelligence is the ability for a machine to imitate human behavior. And I think it's really important to keep in mind that these are programs that are just designed to imitate human behavior. At this point, we're not, or at least I'm not, and I mean, certainly there are applications out there that are trying to do this, but we're not talking about sentient robots that can think and feel and you know, have personalities and that sort of thing, like something you would see out of a movie like I, Robot or Lucy or whatever. But rather, we're talking about is using software to recognize certain patterns and then give it instructions on how to respond. So I know that's sort of a long-winded definition of AI, but I think it's important to understand when we're talking about HR. So for HR specifically, this means that an AI-powered bot, or sometimes referred to as a chatbot, could, for example, respond to emails inquiring about open positions, or maybe they're going to give answers to questions from employees about their benefits, or let employees know about their company vacation policy and so on. One of the key aspects of artificial intelligence and why it's so often paired with the term machine learning is that the performance of AI can improve and should improve over time. So the more data that you have to input, the better the AI becomes, and those predictions or triggering responses can get more tailored to the individual. Now, again, going back to HR, you can start to see that this could be really powerful for any role that requires communication, but HR specifically, because so much about a human resources manager's role centers around communication and, managing individuals. So if you can think about the different ways that roles can be automated and anticipate repetitive questions or tasks, then AI can really help these individuals scale and let them become a much more effective manager of people, especially at a company where there's a lot of change, a lot of new employees, and those sorts of things. So I really am excited about what AI can do in the HR space.
Right, and I think we're kind of early in the technology curve for where AI is.
Absolutely.
Right? So with the additional training, so this is what you were talking about with the data models, where the answers get better, which we classify as more human, right? So get more human as you train the model more. This becomes more useful. It can answer a wider variety of questions. It can replace a lot more of the repetitive tasks that we don't need to necessarily do. And I think that is very powerful because HR has often been so administrative, and it brings me to my really next question, which I get all the time too, is that, is your AI going to take the human out of human resources?
Yeah, I like this question as well. And I think that the exact opposite is going to happen. So I want to start with a quick analogy. So it's worth considering what's happened in the manufacturing industry. Going back to the Industrial Revolution, more people moved into cities, away from an agrarian lifestyle. A lot of jobs became more specialized and monotonous. Individuals would basically be tasked with doing one thing over and over again, all day, every day. And I think we saw some of the effects of this. For anybody who's read The Jungle or think back about all the various different health concerns, when people were only doing one thing over and over again, it stifled their creativity, their independent thought, and in some ways, I would argue that even their intelligence was declined by this monotonous task. So we've gone through this process. We've already automated much of the manufacturing process using machines and robots for what humans previously did. But rather than destroying the entire industry, the people who are involved in the manufacturing industry are taking on much more interesting and creative roles. People who used to be factory workers are now able to do a lot more with their time. And then you have more jobs that are being created, high-skilled jobs, for people thinking through how to improve the efficiency of the assembly line or coming up with new supply chain innovations and logistics strategies. And I really think that this is mirroring what's happening right now. Obviously, there's going to be some upheaval whenever there's change, and individuals will have to learn new skills and we'll have to retool and re-educate our workforce. But at the same time, I also think that there's a lot of promise there, and it's really exciting. So going back to HR, the role of the HR manager is not going to go away by any means. Rather, it will just fundamentally change. So instead of being a person responding to the same questions over and over again, or simply tasked with distributing paperwork to employees or screening candidates for recruiting, HR managers will be given more freedom and creativity to think through cooler projects like innovative recruiting strategies or how to build and maintain a strong corporate culture. HR will become a more strategic role, in my opinion. And I think this is something that we're already starting to see with companies like Google and Facebook really leading the way and showing what it means to be a people manager. And even in that title, you're starting to see that change take place already. So fewer and fewer people are being referred to as an HR director or a member of the HR team. Rather, you might have somebody who is called the head of people and strategy or people operations, or the person charged with, chief culture officer or something like that. And I think all of that reflects the way that machines, AI, systems that we've designed can free up HR managers to be much more creative and intelligent and really do the things that we hired them for, which is to help move the ball forward on making our resources the most effective. And there's no better resource than the humans that you employ.
That's true. And also one of the most limiting things on me and everyone is time, right? So I could not agree with you more about freeing up time. So now let's assume the fact that AI is going to help, these technology solutions that have a lot of automated things will help me free up time. With that time, I'd like to spend that time in building strategies, right? I want to spend some of that time building strategies to engage employees. So my last questions to you is about, how do I, as an HR manager, build a strategy for engaging employees?
Yeah, you saved the biggest question for last, and the one that has probably the hardest answer. So let me start by saying that obviously I am no expert on the topic, and there's a lot of different answers to this question. But I think that we want to start by thinking through what it is that your employees are doing, where they're located, what are the demographics of each individual company. So that said, there's really no one size fits all for building a strategy around engaging employees. I think it's really trying to think through all the available tools and what you have at your disposal. So when you're looking to build a strategy, one of the things that we started with, even just building a product, I took a very product manager type approach to Orderly, and that was just talking with users. So in the case of an HR representative or an employer, your constituents are your employees. It's really important to understand what it is that they're doing. Get out in the field, talk to your individual employees, find out what are the things that they're doing the most, what are the tools that they're using. If you offer Slack or Skype, how often do they use that? Or are they chatting with their colleagues using other tools like WhatsApp or Facebook Messenger? And if so, be open-minded about thinking about new ways to maybe engage them by using the tools that they already use. That's why we put these icons up here, and that's really been a big part of Orderly's product development, is trying to meet individuals where they are. So another key component of this is definitely do not want to assume that just because you have something or just because you build something that your employees will use it. So even if you pay for Slack or you have some newfangled application that is really going to change the way that people interact at the workplace, you have to make sure that you get buy-in and get internal champions to do that. A company that's done this really well is Nextdoor. They basically have ambassadors within their organization that are users who are their ambassadors to help expand the use of their solutions. I think this is something that, I would like to think Orderly does a really good job of this, but I also think that Optimity does a great job of this, of really trying to tailor the experience to the individual and making sure that they are met where they are. It's not just a one-size-fits-all approach. And then the last part, as you can see on the slide, is thinking about this from multi-platform. Again, there isn't just one solution. In our case, you can interact with Orderly on the web, on SMS, on Slack. We're also trying to develop into other language interfaces like Alexa and Google Home, Facebook Messenger, and other chat-based platforms. And I think taking that approach with your employees is important as well. So if you have, if you're trying to help with health and wellness, you can use local health fairs and communicate that via Slack or email or SMS. Have individual opportunities for your employees to contribute, hold forums and town halls. All of these various different things are important when it comes to getting buy-in and then making those constituents feel like that they're heard. So the more that you really just take a step back and think about it like a product manager, just understanding your users and where they interact, all of that really feeds into trying to design the appropriate strategy for your company.
Right. So as we build more technology, we're finding that, right, there's this big rise to where we're actually promoting human-centric design. So Some of the data, I wanted to just take some time to share some of the data that we have about engagement and how different types of technology could be used. So the last 10-15 minutes will be around sharing the data that we have and the information that supports it. So first of all, we know from experience, and many of you know as well, from launching everything from wellness portals to just health apps, or buying wearables for everybody in your company, or even doing classroom coaching. We looked at data across a lot of the clients before they converted over to us, and we looked at what's happening to them. So you get these spikes of usage that are seasonal, that are sometimes coupled with particular spending or some sort of unlocking of insurance dollars or matched funds. You have these things like that. But then if you look at the baseline numbers, that's always around 10%, 5%. So it's really poor. And even if you buy Fitbits for everyone, right, you can see that after 2-3 months, the real number of people that are using that pretty big spend is less than 20%. And that's true across all of the different things that we use traditionally. Over the last 2 years, we at Optimity have been experimenting. We've been experimenting with recommendation engines, right? Because we're influenced by other tech giants like Netflix. A lot of us have Netflix and we watch it, and we're so used to these recommendation engines where I watch a couple of movies. I watch 3 movies, they're by specific types of actors or in a particular genre, and then all of a sudden I get other recommendations that make sense for me and that I want to engage with more. So it's kind of an addictive usage of the platform. And we've been experimenting with that as well within the platform, and we're seeing that by recommending more nutritional content to people who are interested in nutrition, they come back, right? So our curve looks quite different, and it goes up after the first 20 days, after the first 2 months. We see this inflection where people are understanding more and appreciating the fact that it's customized to them. It becomes more of that personal touch, a coach that is not only, another great thing about AI is that it is a robot, it's not judgmental, right? So it never judges you. So whatever you do, it's just always consistently there for you 24/7. It gives you the content that you need. So that's really lovely. Another thing that we kind of stumbled on, which was very useful, and we now have a full strategy dedicated to it, is about context. So it's about a sync. So at one of our clients' requests, we synced with people's calendars. So we synced with their first their Google Calendar, and with permission the Outlook. And we were starting to understand, people are busy or not busy, because one of the complaints that people had about certain wearables is that it would tell them to stand up when they're, in a car or in a meeting, and that doesn't make sense. So what we started to do is to look at when people are available and for how long they're available, and be opportunistic in the content that we give them so that it's contextual to them. So that's another big part of how we use the AI within our platform. Some of the other stuff is not quite AI related, but it comes with the big data piece of it, which is about connected apps and devices. So we connect to literally hundreds, so over 400 devices and apps. So it allows people to bring in all that data onto one platform. Oftentimes we get compared to, solutions. People don't want to have, a million apps. So it's about, having all 15 things that you need to do: track sleep, nutrition, exercise, mental health, financial wellness, having them all in one place. So this way you can really build that sustained engagement strategy. Another thing that we that a lot of people focus on is with wellness programs is on impact. So we talk about ROI, we talk about the value that they are getting out of it, and it's specifically around risk. And this comes from my background as a risk officer as well. What we had in the well-funded medical research arena is that we have lots of, we have brain scans, we have MRI scans, we have blood scans, we have all this data that I can parse through and look at and make decisions on triaging these patients. And it's really useful because then you have a limited pool of budget that you have to disperse across to a set of people who are not equal in terms of what they need and who are not equal in terms of the urgency that they need it. So I find that algorithms, which is really kind of the grandfather of AI, are the best ways to really use that to triage the different types of patients. So you can put someone who has a more acute issue much, they can see a doctor faster, they can get the things that they need faster. So we're actually using that in wellness as well, so that people can dynamically, we use a health risk assessment, a dynamic health risk assessment to group people into different types of aggregate information. So we have risk profiles for heart disease, diabetes, whatnot, and then we retarget content based on that. So that's kind of how the AI works. In terms of results, you can see the proof is in the pudding. We have many client case studies and results, and some of which I put one up on the focused one in the downloadable materials. So you can definitely take a look at what it is in the handouts. But I'm happy to explore numbers for any of you that are very numbers inclined, because I think that's also a very big strength of having data and having automated things that help you do your job better, not just spending more time on it, but working smarter. So with Optimity, a little bit about us. We're a AI-powered dynamic wellness company. We build a flexible and scalable wellness programs for employers that focus on the daily positive micro interactions. So these are interactions between 30 seconds and 2 minutes. They're personalized, the personalized mobile first experience. So we're available for all mobile, although we do also have a web experience, but I would say 90% of our users is on the mobile. We offer holistic health library. So holistic health really means everything from not just physical, so it's not just a weight loss program or a smoking cessation program, but it's really looking at mental health, heart health, financial wellness, and productivity. So it's really kind of all the way across the different spectrums of well-being. And of course, we personalize. So we personalize based on people's job function, personality, and also their own goals. The Pocket Coach itself has different types of gamified elements to it. People can sync to their calendar and they can earn rewards as they go through that experience. And we're finding when we go back and look at the data, a lot of the employers are looking at, everyone looks at data. I'm sure you look at your own data, you look at your cost analysis, and you look for insights. You get insights from your advisors, your consultants, yourself, your analysts. But a lot of times the action that results from the insight is what causes a problem. So a lot of the key problems that we have identified with our clients is, they started with low participation. So that graph that you saw, a lot of people disappear over a period of time too, which is the low adherence piece of it. And when they dig deeper, they find that it's because the program itself is kind of one size fit all, right? People are different. Something for a 53-year-old male will be quite different for a 25-year-old female. So it's really looking at people in their different life stages, so missing adaptation of the program, and then also poorly optimized incentives, right? So seeing the same type of rewards. Not everyone's driven by money. We're actually seeing a lot of usage by people in their social and team groups. So we help close that loop. We have really high participation, 77% participation across 83 clients now. Really high weekly adherence, 43%. Really high adaptation of the program. And that's where AI comes to play, as well as dynamically optimizing the incentives. So that's another place where these are just really spreadsheet calculations now put into an automated system. That brought back to a modern workplace, it means, right, really the modern wellness practice. So we help you with improved productivity, reduce health costs, a stronger culture, and about attracting and retaining your talents and boosting morale. And last year when we did the survey in December, we had over 92% of the users say that they are feeling more connected to their company because of the things that we're doing for them from the brand of the company. So their Optimity experience is not really disruptive. It understands who they are. It messages them when it makes sense, the same way that Kevin was talking about it, right? So it's through their phone. It's almost like a friend chatting to them. They kind of understand that. And then all the activities we ask them to do is so small, right? It's like, I'm asking you to maybe sit up as you talk to me, as you're listening to this presentation. And you can completely do that. You will engage your core, and this helps reduce your likelihood of getting pain for your back. It helps you be more attentive. And of course, it has a lot of downstream issues that help you avoid, such as, feeling stress and things like that. So all the little micro activities help each person make healthier choices. And as an organization, you get more productivity because less pain, more people are engaged, more energy. Of course, all that is related on the holistic part. I like to be quantitative in how we define health state. So oftentimes we also use data and we let it feedback on itself within the platform on the data side to see where people move. So we have a baseline survey. We usually do a baseline survey before people start the program and then 90 days after, and we measure them on 7 criteria. So this is everything from stress level to their energy, to their posture, activity level, their hydration level, how they're thinking, so positive thinking. Mental health is a very, very big topic right now, and I do love it because we see really big impact within a very wide population because this is starting to gain momentum. And then, of course, last, stretching, so we can all do with a couple stretches. All right, so Kevin, what about, can we summarize, can we go away, kind of summarize and the big takeaway from today? Do you want to talk about the big parts of what you talked about? Kevin?
There we go. Sorry, I think you had muted me. Sorry about that, Jane. Yeah, so I mean, I think I agree with everything that you said. I really like what Optimity is doing. I think that we have a lot of a shared mission, but ultimately, I think the key to take away with AI, some of it's summarized on the slides here. One other thing I would add is not to be afraid of it. So not only does AI hold a lot of promise in terms of improving employee health and also improving the way that they engage with their health and wellness, their benefits, the various different ways that they can get access to care, all of those things can be enhanced with AI. In addition, we can support the scalability of companies, the scalability of HR roles, allowing people to get better service with less high-touch human help, and then incorporating chatbots into various different workflows. All of those things will really help. But ultimately, I think if I could be a champion for AI and for chatbots generally, I think that we're still early in this game, and it's important to not be too afraid of these things. If you think about the early days of even iPhone apps and any software that you've experienced, a lot of times the first time you used it, it wasn't always 100% perfect. And I remember the first version of the iPhone, you couldn't even copy and paste. But you were willing to make concessions for the benefits that you were able to garner from this new technology. I think the same thing should be said for AI. I've yet to experience a chatbot that interacts with me exactly like a human does. I don't know how many people have used Siri and have been frustrated with Apple's chatbot at times. But I think that by embracing the technology and being early adopters, everyone on this call can be a force for change and can become an evangelist for kind of what's next in this industry. So, I'm personally really excited about it. I hope that you guys will sign up for Orderly and Optimity. Give both me and Jane feedback on what you guys are doing. And then, what Jane just switched the slide. So for today, for everybody on this call, we're offering free shipping on any first medication order. So you can sign up and if you transfer a medication to Orderly's online pharmacy, that'll ship for free, in addition to probably saving you upwards of 20% compared to your local pharmacy. And then for those of you in Colorado, you can also get $10 off an annual premium account with the discount code Optimity18. We are trying to roll out to other states across the country for premium soon. So if you'd like to sign up today and you ask for premium, you can get on that waiting list, and we'll let you know right when that's available. But rather than just promoting Orderly, I do want to just make a plug for all of you guys to be those agents of change in technology and helping us adopt and improve employee engagement through solutions like Optimity and Orderly and software in general. So Jane, I just want to say thank you to you for inviting me, and I'd love to hear any questions that any of you guys still have on the line, because we love talking about this stuff.
Yeah, I have a couple of questions that have been submitted, and for everybody else, please feel free to keep on submitting them as we're going through them. The first question that I have for you is Orderly a US product?
Yes, actually. I used to live in San Francisco, and then as I told you about my Genesis story, we moved to Denver to start the company. Our focus is primarily on the US-based healthcare system. I have actually never tried it outside of the United States. Because of the way that we actually source our data, it is possible that there are areas in Canada where you'd be able to do things like find a doctor, but more than likely that may not work because we're looking into specific US healthcare plans. So if whoever asked that question, you have some thoughts about us being able to potentially roll this out in Canada and use cases there, please let me know. I'm happy to entertain that conversation. But for now, it's available across the nation in the US only.
Very good. I have another question here, which is, what are the most popular type of questions that is asked of Orderly?
Yeah, so it's so interesting. This is one of the great benefits of having a chatbot is that unlike search, we always know what users' intents are. And we actually used our users' questions to develop our functionality. That was, I was talking about that a little bit earlier, about taking advantage of user interactions to improve the product, and then the machine learning component of AI on how it improves. So to answer your question, I don't know that it would be surprising to know, but a lot of the questions that we get related to conditions are really around sexual and reproductive health. So people might ask questions like, what should I do for, where's the best place to get in vitro fertilization, or am I covered for freezing my eggs, or other things related to STDs and STIs and that sort of thing. And the nice thing, as Jane mentioned earlier, there's no judgment from a bot. Now we do back up our AI with humans, but all of us are trained with a law here in the United States called HIPAA. All of your data is 100% private. And one of the great things is that because you're interacting over text, it can be a little bit more freeing, even when you're talking about really sensitive topics about personal health care. Aside from the conditions, we also get a lot of questions around, I think our two biggest use cases, aside from the sexual health, is really around finding covered doctors and managing medications. I think both of those things, the insurance companies here in the United States haven't made it terribly easy to find the best price, and a lot of times the data for covered doctors is wrong, and because Orderly is using specialized data sets for both of those different use cases, we are very often more accurate and have more data than the insurance companies that we support.
Wonderful. I have another one coming in. It's from a gentleman called Mehdi Taib, and his question is, to make machine learning possible, we need a large volume of data. How can a company that is being data-oriented get enough data about the employee to improve the engagement?
Sure, and that's a great question. I don't know that I have a perfect answer for everyone on the line. But what I would say is that one strategy that we employed with Orderly was by leveraging existing different solutions, we could sort of stitch them together and provide a much more powerful solution in the aggregate. So what I mean by that is that our company could not have existed even 5 years ago. But there are a lot of different organizations out there that are starting to use AI as a service and allow you to basically pay into a platform to build out a natural language processing interface. When it comes to a specific employer and understanding their individual employees, that's a harder question to answer. But what I will say is, don't be too intimidated by the complicated nature of natural language processing and artificial intelligence. Just with a little bit of research, there are a lot of different solutions that I could help point you to. And for anybody on the line, if you were willing to reach out to me, I'd be happy to point you to some of those various different solutions that are available.
Definitely, and I can answer the question from my perspective as well. Yes, we get data from two different sources, or three different sources really, but two different sources aside from the actual employer and employee. The first one is a publicly available data. So the library is actually built with other well-known libraries that's available in the public domain. And then the second one is also, exactly what Kevin has said. We do have partners and we work with people that are basically donating their information for the better usage of the public. So we also have different libraries that we're stitching together that creates this baseline, this base product that helps with the querying. And then the third part is also correct, because as we service more companies and clients on aggregate, we have a lot more learnings. So what's really interesting, we heard this use case pretty recently, but we love it. So we were talking to this chief operating officer of a company, and he has specific issues with timing and traveling and specific issues around his job function and his health. And he felt that he was really accumulating risk and also pounds because of his stresses. And one thing that we ask people about their job function and their personality and what their goals are. And then we, of course, grouped him with other chief operating officers who are similar, right? So because we're going across all the different companies, he's not so lonely in his journey. So he's actually getting the learning, although he doesn't know this other community, who these other people are, but he's actually getting learnings and their best recommendation of activities of what they have learned. So he's actually learning from them, and he found that really, really interesting, because it's now you're in that group. And I feel the same way too, right? Because in each company there's one CEO, and you're learning from other CEOs, so you want to take on the habits, especially when it comes to health. Everyone lives the same 24 hours. Everyone has to eat and sleep. So it's really good to have that accumulated learning from other humans. So now with tens of thousands of people that are on this, almost on a daily basis, just the trajectory of the data that we have and the learnings and the cross-sharing, the crowdsourcing of intelligence, I feel like that's where we're unlocking a lot of the power of machine learning. Okay, I see also a couple of other questions, but just in the interest of time, we will reach out to everyone else for their questions for a different time. I wanted to share the contact information for Kevin, who has so graciously shared a lot of his knowledge about building his own solution from the ground up, and also the applications of that. So Kevin's contact information is here. You can email him at kevin@orderlyhealth.com or just visit them. There's special promotions that we've also shared. The recording and the slides of today's webinar will be shared by tomorrow, so you can freely share that with your colleagues so that we can grow this community of tech innovation and best HR practices. Of course, reach out to us anytime at engage@myoptimity.com. Thank you again for spending your afternoon with us, and we hope for you to have a great rest of the month. All right, have a great day.
Thanks, everyone. Thanks, Jane.